Hello everyone, I am Dr. Shankar. Welcome to NEET-PG 2023 recall question. So starting with question number 1, but before the discussion, just one thing to say, these questions are recalled by some of my juniors. So please do correct me if I am wrong in any question. So starting with question number 1, if patient farmer by occupation presented to ER with history of organophosphorus ingestion OP poisoning was started on atropine and oxime. So 2 hours later he developed fever. What is the possible reason for developing fever? And the options were atropine toxicity, oxime toxicity, inadequate atropine dose and infection. It can't be infection within 2 hours, it not inadequate atropine dose, it is not also oxime toxicity. The correct answer will be atropine toxicity. So the answer is atropine toxicity causing drug fever. So what are the side effects of atropine toxicity? As all of you know, hot as hair means body temperature may rise up to 105 to 107 degree Fahrenheit. So this was the question asked because atropine toxicity can cause increased temperature or hypothermia, and other features include flushing of face, red conjunctiva, photophobia, dilated pupil, blind as bat, dry like bone, mouth and throat will be dry, intense thirst, nausea, vomiting, drunken gait, drowsiness, etc. So the answer will be atropine toxicity for this question. Coming to question number 2, a child presented with weakness. So child presented with weakness, mother gives history of raw egg ingestion for several years. So the clinical clincher is raw egg ingestion along with weakness. So which vitamin deficiency is responsible? Here the answer will be vitamin B deficiency. If you ask me more details which vitamin B deficiency, then the answer will be biotin deficiency, because consuming raw eggs on regular basis causes biotin deficiency because avidin is present in the raw egg which tightly binds with biotin, thus making the biotin unavailable for absorption. So avidin is responsible for decreased absorption of biotin or one type of vitamin B. So the answer is vitamin B causing symptoms like weakness in a child with raw egg ingestion. Next, coming to question number 3, a woman with vaginal discharge, history of multiple sexual partners. So which kit is to be used for treatment? So this is very important topic for every competitive exam. In this question the answer will be green. So green kit is the answer, as all of you know from this kit color correlation. If it is urethral or anorectal or cervical discharge, then the answer will be grey, but the question asked was vaginal discharge. So in this case the answer will be green color kit has to be used for treatment of patient with vaginal discharge. Coming to question number 4, a 10 years old child with cola colored urine, BP normal, creatinine was 2.4, history of pyoderma or infection 2 weeks back. So it seems like after 2 weeks of pyoderma, cola colored urine, seems like it is a case of PSGN or post streptococcal glomerulonephritis. So persistence of symptoms even after 3 weeks along with rising creatinine. So the microscopy expected. This is a typical case of RPGN, rapidly proliferating glomerulonephritis, also called crescentic glomerulonephritis. This RPGN is following post-infectious glomerulonephritis, PSGN. So this RPGN is nothing but PSGN. After PSGN, type 2 immunocomplex mediated RPGN. As all of you know, there are 3 types: type 1 RPGN anti-GBM, type 2 like IgA deposit or post PSGN or ANA related, and type 3 is posse-immune or vasculitis related like GPA or Wegener granulomatosis, microscopic polyangiitis. This was typical presentation of post-infectious glomerulonephritis. So in this case you will find this crescent. You can see here some crescent shape structure in the microscopy. So the crescent will be seen in RPGN or crescentic glomerulonephritis. Coming to question number 5, Clonorchis sinensis is associated with which cancer? Very straightforward question. The answer will be cholangiocarcinoma. So Clonorchis sinensis is associated with cholangiocarcinoma. Rest of the options are wrong. So coming to question number 6, image based question from eye or ophthalmology. So what is the diagnosis? You can see one swelling in the region of limbus. It is nothing but limbal dermoid. It is not pterygium. Pterygium is triangular shape structure, or it is not also pinguicula. It is limbal dermoid. Coming to question number 7, where this type of murmur is seen. As you can see from this auscultogram or phonogram, here this is S1 and this is S2. So in between S1 S2, this phase is systole. So this is systole, and from S2 to another S1, this phase is called diastole. So as you can see from this image, this is nothing but a typical presentation of pan-systolic murmur. Murmur is present throughout the systole. So this is pan-systolic murmur. This is pan-systolic murmur. So in which condition pan-systolic murmur is seen? Yes, it is nothing but MR. So pan-systolic murmur is seen in MR or mitral regurgitation. In case of MS, which type of murmur is seen? Yes, you are absolutely right. It is opening snap first, then mid diastolic murmur followed by pre-systolic accentuation. In this case, the answer will be MR, pan-systolic murmur. So new type of questions with image phonogram likely to be asked in upcoming exam also. So one asthmatic patient presented with oral candidiasis. So which is the best treatment for this patient? The answer is it griseofulvin? No. Is it terbinafine? No. Is it flucytosine? No. So the answer will be clotrimazole. So oral candidiasis, asthmatic patient presented with, maybe because of some inhalational corticosteroid ICS use through MDI or nebulization, that may cause opportunistic infection in the mouth, oral candidiasis, and the best treatment will be clotrimazole. Next, coming to question number 9, pulmonary fibrosis and hypothyroidism, side effect of which drug? The answer is very straightforward question, amiodarone. Amiodarone drug side effects are very important for NEET-PG or any other competitive exam. As you can see, the side effects of amiodarone, the action is prolongs the action potential duration. This is mechanism of action, and the side effects include photosensitivity, pigmentation of skin. This image is also important, blue-gray pigmentation, amiodarone induced, multiple time asked in the exam in previous sessions. Peripheral neuropathy, this is pulmonary fibrosis, this was asked. Also, it decreased peripheral conversion of T4 to T3. So it causes hypothyroidism. So hypothyroidism and pulmonary fibrosis is a side effects of drug amiodarone, antiarrhythmic drug. Coming to question number 9, which nerve injury is most common following laparoscopic surgery? Laparoscopic hernia surgery. Yes, anyone can guess? Yes, it is nothing but lateral cutaneous nerve of thigh. So what is this condition is known as? Lateral cutaneous nerve of thigh. This is known as meralgia paresthetica. So the answer is lateral cutaneous nerve of thigh, most commonly injured during laparoscopic hernia surgery. So this is first 1 to 10th number question. In the next video, I am going to discuss question number 11 to 20. So stay tuned for the next video. Thank you very much for watching.